Dr. Phillips, why did you become a doctor?
Why did I want to be a doctor? So I actually come from a family of doctors. So I would say, I had role models in my immediate family that showed me what a life of being a doctor was really like. And I knew when I saw them that I could do it.
Tell me a little bit about the work that you're doing in cell therapy and bone marrow transplantation.
So my work in cell therapy and bone marrow transplantation has primarily focused on one disease in particular called HTLV-related adult T-cell leukemia lymphoma, which is a diagnosis seen primarily among Caribbean Americans or Caribbean immigrants to our region. During my training, I saw case after case, and the patients unfortunately had a poor prognosis. So I wanted to, do better and to learn a lot about the disease. So my initial research was focused on the epidemiology, just describing the patients, their clinical course, the different treatments that they received. And then I went on to get a number of awards from the American Cancer Society, which supported my clinical research. So I've been the principal investigator of a number of novel therapies for this condition. And transplant is really the only curative option for patients with this disease. So my work has been on clinical trials looking for better treatments and for transplants in these patients, which can potentially cure them of the disease.
Dr. Phillips, what does it mean to you to be a woman, but more than that, a woman of color in the field of oncology, breaking down barriers in the cancer space?
So I'm incredibly proud to be a woman, and particularly a minority woman in the field of oncology. There are not many of us in the field, and certainly minorities can have poorer outcomes with different cancers. So I'm really proud to just be involved in research, looking for new therapies, trying to enroll patients, particularly underrepresented minority patients, more women, onto clinical trials.
We heard that your dad, your mom, and your grandfather worked at Newark Beth Israel as doctors. What kind of medicine did they practice?
So I come from a family of doctors, and my grandfather came from Barbados and ended up going to medical school and set up a private practice in North New Jersey. I would eventually also work briefly at North Beth Israel. My father was a resident at North Beth Israel. My mom was actually on staff at North Beth Israel as a practicing oncologist.
So tell us what it means to be a part of the Rutgers Cancer Institute of New Jersey and RWJ Barnabas Health family.
Being part of the RWJ Barnabas Health and Rutgers family, for me, it's like coming home. I was born and raised in Newark and outside of Newark here in northern New Jersey, and now that the RWJ Barnabas Health system has such a presence in this area, being the director of CAR T and transplant for the 6 hospitals in our northern region. For me, it's just exciting to come back home and practice in a community that raised me.
Dr. Phillips, how can patients make an appointment with you?